Good afternoon. It is Monday. Wow. It is the month of June, June 7th. And I want to welcome you to our member connection. We are the Miami-Dade Chamber of Commerce and just excited to have you here. And before we get started, an announcement word from one of our supporters.
Hi, I'm Matthew Pinzer, the Chief Marketing Officer at Jackson Health System. We're proud to be partnering with the Miami-Dade Chamber of Commerce to bring you this video series. We hope that it helps you to find new business opportunities across our community, and we look forward to working with you as we move into a new year.
So this is a first time since we've been doing our member connections, and I'm here trying to make sure I got my Facebook sharing going. And let me get my glasses so I can make sure I read right. We got two gentlemen with us today. Vax 305. We got Dr. James, Medical Director, Indelible Solutions, and we have the Director, Mike. You know what? I'm getting ready to mess it up.
No worries, President. It's all good.
Michael?
Yes, sir.
Michael Scott. So, Michael is a transplant from Palmetto, Florida, and Dr. James II is from Bainbridge, Georgia. But Vax 305, I know we've been dealing with this pandemic. Here we are in June. And you gentlemen are doing something that definitely is needed. First of all, I'm going to ask Mr. Scott to let the audience know who you are, and then we're going to go to Dr. James.
Absolutely. Well, President Knowles, thanks again for having us on this morning. My name is Michael Scott. I serve as the Director of Government and Corporate Relations with Indelible Business Solutions. We're a minority management consulting firm, a national firm based out of Jacksonville, but we work closely with the state of Florida and have been handling COVID outreach and awareness with them for the last several months across the state.
Okay, Dr. James.
Hey, definitely. Good afternoon, President Knowles. Once again, in addition to Michael, thank you for having us on, allowing us this platform just to, spread a little light onto a much needed topic. I'm Dr. James, President of Healthcare Equity Solutions. I'm serving as the Medical Director with Indelible Solutions for the COVID-19 vaccination outreach program.
Okay. Obviously, very important topic. We have a lot of folks who are opting out of getting a vaccine. We've had news where some of the vaccines were put on hold because some negative reactions. And then now we have some states providing lotteries and tuitions for folks to take the vaccine. So jump in. Let us know more about Vax 305 and what got you into doing what it is that you're doing.
Absolutely. So Vax 305 is actually a strategic partnership between Indelible and the Florida Division of Emergency Management, as well as the Florida Department of Health. So as I mentioned before, our firm is more particularly situated in the emergency management space. So we work on a lot of natural disasters and assist the state of Florida, along with other states across the nation, when it comes down to different issues related to public health, as well as setting up governmental programs. And so the Vax 305 initiative is important because statistics are showing that in minority and underserved communities, folks are getting vaccinated at a much lower rate than our white counterparts. And I think it's really great that we're here today with the Miami-Dade Chamber because this is the community and the network that we really need to be speaking to let them know why important and how important it is to get vaccinated and to also get the right information. Because we're learning there's a lot of misinformation out there that are causing deliberation and hesitancy in these groups. And we want to make sure that we can get them the information and access that they need.
Okay. So Dr. James, and how did you get engaged with this?
Definitely. When we talk about the demographics that are being affected most, when we talk about African-American communities, Hispanic, Latino communities, we make up 2/3 of all new cases of COVID-19. Yet, in contrary, we have the lowest vaccination rates than any other demographic. 17.4% African American, 17.8% Hispanic Latino. So that shines great light on us and says, hey, there's something that needs to be done here. There's a gap, and we need to be able to meet our counterparts where they are, meet our people where they are, and help close that gap in that road to vaccination.
And what would you say some of the apprehension is behind, obviously all the reports show that we are comorbidities, that we're being affected more by COVID-19. So that information is out there that our community, when it comes to anything, systemic issues in our community, we are the ones that are being affected negatively more than any other community. So with that being said, we should be at the front of the line to make sure we're protected. And so
Right.
Obviously there is that negative response. We talk about, and I look at the fact that you went to Tuskegee. So
Yes.
so let's talk about that issue. Obviously with the experiments that went on back in the 20s and so on and so forth. So there is that mental apprehension because of what we had previously from a historical perspective. So deal with that.
And Dr.
Yes.
Would you like to take it?
Yes, definitely. President Knowles, and that's what we like to call healthy hesitancy. We can't deny the fact that the Tuskegee experiment happened. We can't deny the fact that those people in Macon County, Alabama, were targeted and denied treatment to determine the outcome of a disease state. But when we look at something like COVID-19 and we look at the world itself, this has become a pandemic, which means at this point, this COVID-19 virus has touched all 7 continents. This isn't a ploy or something that has just been targeted for African Americans alone, Hispanic, Latino people alone. This is something that the world as a whole is dealing with. So my main message to everyone that, refutes vaccination with the Tuskegee Institute experiment, I would always say and refute it as, this is something that the entire world is dealing with. And this is nothing that is targeted to African Americans or Hispanic or Latino people alone.
Right. Well, as I ride around the community here in Miami, I see a lot of free testing on various corners. It's not even you even going to clinics. It's up on the corner and it's free testing. And I actually see people in line. What would you say are some of the challenges even with getting tested?
Well, I mean, I think some of the challenges now, right, when we look at the pandemic as a whole, we're starting to find that while we are still aware that we're in a pandemic state, if you look at the federal and you look at the state governments, there is somewhat of a disconnect, and especially when you look around to see kind of how people are reacting to the pandemic and where we are right now. There are a lot of resources, state resources, that typically go towards these testing facilities as well as these vaccination clinics. And I will say that the state of Florida did a really good job of making sure that there were state facilities in places where typically there wouldn't have been access. I mean, here in Miami-Dade County, there's about 12 state facilities that you can actually go to get vaccinated, and you can get that for free. And they've tried to situate those places in communities that, generally speaking, don't have a Publix or don't have a Walgreens or a CVS where someone can just go down the street and do that. Now, it was made more so with the thought for folks that don't have access or might have barriers to get into those places. But one thing that we've seen, even with those sites being set up and testing, it's still a little bit more than just putting up and having this concept of building and they will come. I mean, we have outreach people that are on the ground right now, actually about 350 plus people that are doing direct door-to-door canvassing, high traffic canvassing, going to community events and really engaging with folks directly while also using elected leaders and community influencers, because it's not enough for folks to know that there's a site down the street. They really need to know from a trusted voice why it's important for them to get this vaccination, and also to kind of educate them about public health at large. Because as you mentioned, President Knowles, pre-existing conditions and comorbidities is something that runs rampant in the Black community as well as the Hispanic community. And while we know these things, a lot of times we don't necessarily have access to the resources we need to combat those issues.
Wow. Here we are, like I said, it's June the 7th. And obviously last weekend or so was a Memorial Day weekend. And, basically in the United States, we're opening up more. And I mean, we in Miami, South Florida is recovering probably faster from an economic perspective because we have the ability to be out, where dining was 100% on the exterior of buildings, 50% inside, and so now you have the situation, like I said, with the government, whether to wear a mask or not wear a mask. How do you all deal with that? Because I'm going around, and I mean, I've been to a couple of events where you go inside a facility and you don't necessarily have to wear a mask. And let's talk about that a little bit.
Well, Dr. James, I'll let you go. I mean, what I'll say briefly, to the best of our ability, right? We are keeping up with the most recent scientific information. CDC has made notice that, as of right now, if you're fully vaccinated, that it's not necessarily required for an individual to wear a mask. However, we still have to be mindful of the fact that the vaccine, while it does protect you and it gives you some of the efficacy, we're still in the middle of a pandemic. And we still also have to be mindful of the fact that certain establishments still are trying to make sure that people are wearing masks. And while we're seeing some rollbacks in that, we want to make sure that people know, hey, if you're out in crowded areas, especially if you haven't been vaccinated, it's extremely important for you to make sure that you're putting that mask on. And it's also extremely important to make sure that regardless of whether you've been vaccinated or not, this disease is still very real. And we have to continue to protect ourselves going forward as we learn more about the virus and these different variants that are presenting themselves.
Right. Absolutely. When we talk about the vaccine, when it was studied, it was designed to protect you from becoming deathly ill if the COVID-19 virus was contracted. So with that being said, it's still, as a precautionary measure, the mask still can protect you from maybe carrying that COVID virus to a grandparent, to a mother, to a father, who may not have such a strong immune system or may not be vaccinated. So definitely the mask is definitely still a precautionary measure. But in terms of the guidance to the public, we try and follow, the most up-to-date CDC guidelines. And right now, as it stands, if you are fully vaccinated, you can be outside or in small groups of people without a mask.
Let's talk about that. Let's talk about that a little bit also. And, I'm getting some questions and comments. I don't know if you could see those in the chat over there. But you do have the question or the apprehension. The fact is that, okay, I get the vaccine, but I still can catch it. I still can get COVID-19. Or why do I have to wear a mask or don't wear a mask? But the question is, and Dr. James, I just want you to deal with that one a little bit in terms of, again, the fact that, and I think you just said it, the point is that you could contract COVID-19, but you're not going to find yourself on a ventilator or in the hospital.
Exactly. And you hit the nail on the head. And that's what the vaccine was designed to protect against. If we think back when this pandemic first started, it was the thing that got everybody really, got everyone's attention was the disproportion, the crazy number of deaths. So when the manufacturers went in to develop the vaccine, they wanted to develop something that would protect us. That you may be able to contract it, but they wanted to protect us from ultimately dying or perishing from COVID-19 virus. So that's where that efficacy rate, that 94, 95% efficacy comes in. if you do contract COVID-19, 94, 95% of the time, you will be A-okay.
Right. So you do, and again, reading some of the comments in the chat, just because we don't see vax efforts targeted to specific communities doesn't mean that there isn't a sinister motive behind this all. I mean, we all hear about conspiracy theories, et cetera, et cetera. How do you deal with those things that are thrown at you?
So for us, right, one thing we want to make very clear, by no means are we vaccine shamers. We're not out here trying to force any type of narrative on individuals. Simply what we want to do is provide people with information and fact-based information. And so along the way, we've really had to develop a way to talk to people in a message and a tone. And for an individual that, has an idea that there may be some type of sinister motivation behind the vaccination process, for me, I look at the science of it, right? We have the most brilliant scientists across the entire world that came together essentially as a dream team to work on a vaccine, to work on a medically sound way to save people's lives. And at this point, across the United States, you've seen over 150 million plus people get vaccinated. And while there have been some small instances of reactions with the vaccine, we've seen some things in the headlines. We know Johnson & Johnson was paused for a moment. But when you look at the facts, right, the facts show that the side effects from the virus and the potential outcome of contracting COVID-19 are night and day. And so we're not here to say, hey, you don't want to get vaccinated. You're not a smart person. You should be doing this. You should be doing that. No, what we want you to know is that the numbers don't lie, right? You can see how many people have been vaccinated. And when you talk about side effects from the vaccine, generally speaking, those are the types of things that you're going to see within the first couple of weeks of getting vaccinated. And most of those side effects are going to be similar to a flu or fatigue or some of those things that you might experience from any other type of typical cold. There hasn't been any type of scientific evidence that's being presented that shows widespread people falling out because they've taken this virus, right? So what we like to say is we're in belief of the science, and that's where we want to keep it, right? We're in belief of the science and the medicine behind it. And we also have to know that this isn't the first time a vaccine has been created and has saved people's lives, right? Historically speaking, there's a lot of vaccines that have even taken certain viruses and diseases out of the conversation to the point where if you ask a child about chickenpox these days, some of them won't even know what you're talking about. So I know that from the Black community, it's hard for us to understand why someone's pushing the vaccine on us so much when they don't push these other resources, right? Well, our communities need food access, right? They're food insecure. Our communities need higher paying jobs. Our community needs better education. So it's like, where is the government when those conversations come up and now you want to talk about the vaccine so much? Well, we're in complete agreement with you there. And that's why, from our perspective at Indelible, we're focusing on a holistic public health approach and not just speaking solely about the vaccine itself, but also doing events where we can collaborate and cohabitate other resources like insurance, getting in front of a doctor, telehealth services, and a lot of other food access resources the same. So people not only know about the vaccine, but you know where you can get other resources to help you and your family.
Well, exactly. I would say, what are some of those resources that you all provide?
And so what we work to do, for instance, in Jacksonville, and we'll be doing similar events here in Miami-Dade County, we actually worked with a lot of community partners, actually worked with a faith-based group, the Health Smart Coalition, with about 20 plus churches who do food access resources on a weekly basis to people in those communities that are hardest hit in Duval County. And so we collaborated with them along with other organizations like AHEC, Humana, and a lot of other localized groups that provided things like food. They provided insurance. They were letting folks know where they can go and get insurance with as little as $0 down and extremely small copays. Also early education services and daycare. So we're trying to find ways to bring together all these resources. And that's why it's even great to be on this conversation with you, President Knowles, to say, hey, what other resources are out there within the business community, or what other resources are out there with some of the nonprofit groups that we can bring all of this together? Because the vaccine can protect us from this current issue, but what happens after COVID is no longer the topic of discussion, right? Whenever there's a fallout, whenever there's a natural disaster, our communities are always impacted first and hardest because we lack access to so many other things. And so as we move forward, we want to continue to work with the leaders in the community and these organizations to break the silos. So now the next time something like this happens, our community is in a better position, and they know and have been able to take advantage of those resources, and ideally are moving higher on that scale so that next time that happens, they're not so negatively impacted as they were before.
Absolutely. Absolutely. So if someone wanted to get in touch with you, how can they do that?
Absolutely. So if an individual wanted to learn more about VAX 305, they could go to vax305.com. And we've got a lot of great resources on there where folks can go to get more information about the different vaccines that are available. You can also find where the nearest vaccination clinic is to you by putting your information in on there. And we'll also, I just say, stay tuned, because around the community, you're going to start to see a lot more of us as we work with folks like the Miami-Dade Chamber and a lot of other community leaders to make sure that we bring this information to your doorstep, as opposed to you having to try to go out of your way to find it.
Absolutely. So, well, we invite you to participate with us on June 25th when we're having our general membership meeting. It's going to be at the Little Haiti Cultural Center. So we'll talk about that offline. And for those of you who are watching and listening, again, we are having our general membership new member event on June 25th at the Little Haiti Cultural Center in Little Haiti, starting around 10 o'clock. But you can get that information if you go to the Chamber's website, www.m-dcc.org, or you can call the Chamber at 305-751-8648. And then in July, put this on your calendar. We have our Little Black Dress in Pearls event, our Women's Business Council, and put that on your calendar as well. So, Michael, I'm still messing it up. Director Mikhail Scott,
Mm-hmm. Yes,
and
sir.
Dr. James is the third, or is that the second?
The second.
Is there a third yet?
No, sir, not yet. Not yet.
Not yet. So anyway, gentlemen, thank you so much. Really appreciate it. And we definitely look forward to engaging with VAX 305 and bringing the information needed for our community. And as you said, working on these other comorbidities that we have and systemic issues that we deal with in our community. Thank you so much.
Absolutely. Thank you, President.